And Marco, your turn.
Okay.
Are you ready?
I'm ready. Thank you very much, Tamer, for your invitation, and it's a pleasure to share the podium with you. Are you seeing my slides?
Yes.
Okay.
Very clearly.
My task today is to discuss with you the use of erbium YAG laser on the vulvovaginal atrophy and sexuality. And I don't have disclosure to be done, and I will follow the presentation of Professor Erel that already said that the GSM, the genitourinary syndrome of menopause, is a very big issue for the quality of life of postmenopausal women, because the symptoms of genitourinary syndrome of menopause, the genital symptoms, the sexual symptoms, the urinary symptoms can really jeopardize the quality of life for postmenopausal women. We do have a lot of treatments from non-hormonal, hormonal treatments, systemic and local treatments, or spimifene, the prosterone, the DHA. But today we do have also the vaginal erbium smooth laser. And I'd like to discuss with you the issue, is the vaginal laser an evidence-based medicine option? And Zdenko Vizintin already presented some data, but I'd like to discuss with you, dear friends, my own procedures. I would like to focus that all the procedures you'll be seeing reported in my slides are obtained with the company-validated procedures. All the parameters are preset in order to minimize the intra and interoperator variations. That's why, as the Vaginal Erbium Laser Academy, with my colleagues and friends, Tamer Erel and Ivan Fistonic, we were able in the VELA to put together all our data and to publish very interesting results in hysterectomized women, in women without hysterectomy, just because the same procedures done in Zagreb, in Istanbul, and in Pisa are the same, because the company-validated procedures are based on preset parameters. So the techniques are really reproducible and appropriate for multicentric studies. And not to mention the G-running robotic probe. The G-running robotic probe make everything even easier with all automated procedures. As Zdenko Vizintin said, now we do have 9 years of minimally invasive non-abortive erbium YAG laser therapy in gynecology. And we do have a lot of very well done papers published in international journals, in peer-reviewed international journals. And as Vaginal Erbium Laser Academy, thanks to the support of the pioneer like Ivan Fistonic, Adrian Gaspar, Jorge Gaviria, and Tamer Erel, we were able to have different meetings, and we started the meetings in Pisa some years ago. Sorry for going, I will do, okay. Sorry, okay. We started in 2015, 16, 17, 18, and we had the last meeting in Florence in November 2019. And as Zdenko said, the proceedings of these meetings, this meeting are published on Climateric, the official journal of the International Menopause Society. And please, dear colleagues, take into consideration this is a peculiar proceedings because all the papers published are peer-reviewed. So all the proceedings, all these papers were peer-reviewed by anonymous reviewers, and therefore the validation of these data are very robust. For those that are not familiar with our techniques, I will say that the Renovalase, the protocol for GSM, for the vulvovaginal atrophy, is a two-step protocol. The first step, we do treat with a full beam all the vagina with a 360 degrees conic adapter. And the second step, with the pattern beam, we treated the introitus, the vestibulum. We do promote the photothermal effect with a vasodilation and an increased neocollagenesis. All the data you see, dear colleagues, are the data obtained with 3 different sessions, 30, 40 days apart. We do use, as Zdenko said, the glass speculum nowadays. This is very gentle. And we do introduce the probe inside the speculum, and it is very gentle procedure for the women. They don't feel the probe going back and forth. That is not going to be a very pleasant in an atrophic vagina, the probe going back and forth, and therefore the speculum is very helpful for making very patient friendly all the procedure. You see, the glass speculum goes inside the vagina, and we work inside the speculum, even with the manual procedure or with a robotic procedure. I'd like to share with you our first data on signs and symptoms of GSM. And as you see, dear colleagues, with L1, L2, L3, are the 3 different laser treatments done 30, 40 days apart. And you see the effects in terms of dryness, dyspareunia in the first 105 patients we treated. And you see the decrease of the visual score in 10-point scale. You see here the 60–70% reduction of the symptoms. And this was parallel to an increase that the vagina has in the score. You see here the increase of the score from 11 up to 2022. And I remind you that 15 is the limit for the diagnosis of vaginal atrophy. And you see that just after 1 treatment, after 1 laser treatment, you are able to reduce the discomfort of our patients. But the question is, how can we compare the vaginal erbium laser effects with the standard treatments, and how long our results can last? And in the 2019, we published a 2 years follow-up study in 200 patients treated with the vaginal erbium laser. And once again, you see here that after the L1, laser 2, and laser 3, you see the decrease in the vaginal dryness and patient dyspareunia. But we compare these effects with the women treated with local treatments, mainly local estriol treatments. And you see when you compare the first 3 months, the effects of dryness and dyspareunia of both local treatments, mainly estriol, and the vaginal erbium laser are superimposable. But when the women per protocol stopped the vaginal estriol treatment, after 3 and 6 months, you see that both dryness and the dyspareunia were increasing in those women that were treated just with estriol and not with the laser. While the women that were treated with 3 sessions of laser, they maintain a significant reduction of dryness and dyspareunia up to 12 months. While after 18 and 24 months, the women, they were showing an increase in the score of both dryness and dyspareunia. So, dear colleagues, this observational, that is not randomized, but it's an observational study, can give us the opportunity during our counseling with our patient before treating them to say, yes, with the 3 laser treatments, we can predict a 12 months effectiveness. And in fact, you see that out of 205 women, 84% of the women asked to repeat the treatment, mainly after 12, 18 months. You see 62 repeated the treatment after 12 months, 55 repeated the treatment after 8 18 months, 34 after 24 months. So only 5 women out of 205 were happy 2 years after the last laser application. The vast majority of them, they repeated the treatment after 12, 18 months. And please remind that all those women, they were just treated with the erbium laser. But we can improve also the sexuality in postmenopausal women. And our first reaction with the first data, they were saying yes. You know, these are women. They were treated after breast cancer treatments. The vast majority of those women, they were taking aromatase inhibitors, and you see the effects of vaginal erbium laser L1, L2, L3 on the female sexual distress scale. And I remind you that 11 effectively discriminates between women with a female sexual dysfunction and women without FSD. And you see once again that there is a decrease in the FSDS that is maintained up to 12 months. But you can say, dear colleagues, that 29 women are not enough to demonstrate anything. And for that, the Vaginal Erbium Laser Academy is of help. You see, we collected data on 47 Italian centers, almost 1,300 questionnaires, and these are the data obtained in 554 patients in terms of FSDS. And you see, the effects are there. And please consider that this is a huge number of women included in the sexuality study. 554 patients included in the sexuality study, showing an improvement in sexuality in women treated just after the vaginal erbium laser. These are the results of an Italian large multicentric prospective study. The same apply for the FSFAI, 569 patients with 569 FSFAI domain scores. You see the total score 15 that is improved up to 27 after the treatments, and the effects are maintained for 6 months. So you see the effects are very impressive in terms of sexuality improvement. So in terms of the effectiveness of GSM, we can say that these data are really encouraging for the use of laser in the treatment of GSM in postmenopausal women. And as the Italian Menopause Society, as Zdenko says, we included the laser therapy in the different options we do have in the integrated management of postmenopausal vulvovaginal atrophy. I won't say that the vaginal erbium smooth laser is the sole, unique, but definitely is something that we must take into consideration along with the local estrogen replacement therapy or spimifene, prasterone, and even systemic hormonal treatments. So, but George Clooney says, erbium, what else? Do the gynae need something else? I should say, never say, I don't need anything else, because we always need something else. And I would like to point out to your attention also one of the more difficult things to be treated, that is superficial dyspareunia, the pain at the vaginal opening during intercourse. That is a very common complaint in postmenopausal women, and not only in postmenopausal women, but also in women after vaginal deliveries with episiotomy scars and so on and so forth. And there are, the consensus is that we don't have a consensus on treatment. Do you see? These are the publication on the Canadian Medical Journal. You see the superficial dyspareunia can appear in the hypoestrogenic states after candidiasis, after lichen sclerosis, in the female genital cutting, obstetrical, and we do need effective treatments. You see, these are 3 different patients with a posterior commissural atrophy. Women after younger, she's a 50-year-old woman after chronic infection, on an older women with a lichen and the postpartum scars, you know, after menopause, both lichen and postpartum scars, a nightmare. And for that, for those lesions, we started using the combination of erbium and neodymium. The combination of what both wavelength enables a large number of various applications, as Zdenko says. And to make a very long story short, I'd like to show you this Fotona'nın procedure for face lifting, nothing to do with the gynecology, but you see, pairing together the smooth procedure with the erbium and different mode of delivering neodymium with the refractory and piano, and the light peel with the superficial smooth, non-smooth mode with the erbium. We do have the Fotona for the face, non-invasive face lifting, and we did something very similar for the vulva, pairing both the erbium and neodymium on the vulva, mainly to treat the posterior commissura in order to improve neocollagenesis with both erbium and neodymium. And you see, we don't need much treatment before and after, but the results are astonishing. You see, this is the Visionology score with Renovalase, I mean just the erbium on superficial dyspareunia, just asking the women about the superficial dyspareunia. And you see here, the erbium is working very well. It reduces the superficial dyspareunia. But when you did the gyne 4D, I mean, when you put together erbium and neodymium, the effects are much more evident. You see here the effects on Visionology score in women treated with the erbium and neodymium in the same session. And you see that these each time points are significantly different to each other, suggesting that the gyne 4D is much more efficient in terms of superficial dyspareunia than the erbium alone. So the studies, we do have a lot of studies, thanks to Tamer and thanks to Ivan. We did put together our data. We did some studies in hysterectomized women, non-hysterectomized women, and now we too are facing a new option in gynecology to put together the erbium and neodymium in order to treat women that are more resistant to the erbium alone. We do have a really a huge possibilities. We have a lot of possibilities to treat with the gyne for our postmenopausal women. We do have ongoing clinical protocols to collect information in large database, providing solid evidence on vulvar score, Visionology scores, DFSDS, before, after 3 treatments, and with a follow-up at 3 and 6 months. We do need to understand that the severe cases cannot be treated with just with one mode. We do need to integrate hormones, hyaluronic acids, and our dual wavelength with the neodymium and the erbium. And for that, this is a new challenge for the Vela family that I'd like to underline, that is the biggest gynecological laser community in the world. And for that, we thank Fotona for the unrestricted support for our studies. Thank you, Tamer, for your invitation once again. Thank you.